Hi, good afternoon. On behalf of GBS, I want to thank everyone for attending today and welcome you all. This is one of many of our educational sessions for our ongoing healthcare education series, hosting pretty much every month on various topics we've heard from you and others of particular interest. Definitely really glad that you could join us today for a very timely and topical discussion regarding our post-election regulatory and update. I'm Lindsay Bruderly. I'm the Sales Operations Manager here at GBS, and I'll just be kind of doing the intro and the conclusion today. But before we get started, and before I pass it over and do our introduction to our today's speaker, I just wanted to let all of our attendees know that you're in listen-only mode, and as time permits, we will open the phone lines up at the end for questions and answers. But please feel free to ask any questions during the presentation using the chat feature. This educational series, we're just trying to put together some strategic initiatives to provide insight in education, drive your organization's top initiatives, increase efficiencies with technology, and help to set some of your business objectives by providing this education. Things that we've been presenting and that we will continue to present and educate regarding regulatory and compliance, patient engagement, financial health, technology flexibility and scalability, security and infrastructure, patient and staff safety, and more. So just keep your eyes open for additional communications and opportunities to register for these sessions. We really appreciate you joining us today. So before I pass it over, we have with us this afternoon Chris Emper. He's the president of Emper Healthcare Advisors. We had him on one of our other sessions more recently. Like I said, he's the president of Emper Healthcare Advisors, a health IT industry advisor, and provides consulting services with his firm in Washington, D.C. He specializes in the healthcare sector, healthcare providers, and technology companies to successfully navigate and comply with the complex regulations of the value-based reimbursement models. So for all of our next-gen folks, you may recognize Chris. He's the Vice President of Government Affairs at NextGen Healthcare and the Chair of the Electronic Health Record Association Public Policy Committee. So with that being said, I'm going to go ahead and pass it over to Chris Emper. Again, please feel free to ask any questions along the way utilizing the chat feature, and take it away, Chris.
Great, thank you, Lindsay. Also want to say thanks to Jackie and Joe and the rest of the GBS team for having me back today to talk about this, as Lindsay noted, not only timely but very important topic. This year 2020 has been, I think, unlike any other in the healthcare regulatory space. There's just been, such an enormous amount of activity and really important new regulations, legislation, and decisions coming not only out of the federal government, but state and local governments, with everything that's happening with that has happened with the pandemic, but also with this historic election that has taken on a life of its own, as everything has during the pandemic. The election was over a month ago, and yet there are still some pieces of the election that are still being sorted out, and the reality of the DC legislative and regulatory agenda prior to the election, and for those of you who were able to join us in October for my pre-election regulatory update, that update has been modified and changed based on what's happened in the election, as well as being 5-6 weeks more into the pandemic and really the shifting dynamics from that perspective. And with the now 56 minutes I have here today, try to leave 5 or 10 minutes for questions, but really want to spend about 45 minutes talking about all of those topics, but specifically walking through what the results of the election were, and not only the presidential election, but also talking about the congressional elections, and really with an eye towards what will that impact be, the balance of power in DC, and seeing how things might shake out, and what the balance of power and the different appointments will be in 2021, and then ultimately centering in on what is the healthcare policy impact. What does the industry care about? What are physician groups? What are providers most interested in? and ultimately how will you be impacted potentially by these election results. And again, there are certain things that are unknown now and will be, as I'll explain, unknown for quite a few weeks. But we can, certainly garner a lot based on what has happened now and, what we project to be happening over the next few months. And as Lindsay said, please feel free to enter any questions into the chat as we go. If Lindsay or the GBS team can flag them for me, happy to address them as I go, but also we'll leave a few minutes for questions at the end. So with that, I'm going to dive in the election results. So obviously the presidential election was sort of the top line. The results of the election took a few days to trickle in and was kind of unknown there for quite a few days as to exactly what was going to happen and how the results would shake down with the addition of so many mail-in ballots this year and sort of changes to the usual voting procedure based on the pandemic. But we have Vice President Biden, now President-elect Biden, former Vice President Biden, now President-elect Biden, defeating President Donald Trump. You see here the count in the Electoral College, 306 to 232. Ultimately, compared to 2016, Arizona, Georgia, Michigan, Pennsylvania, and Wisconsin flipped from the red column to the blue column and delivered the win for Biden. That being said, President Trump has still not conceded the campaign, has not conceded the race, and there are active lawsuits in several of the swing states. Although, as I'll note on my next slide, the Electoral College has its own timeline, and the sort of time remaining for those lawsuits to be effective is quickly dwindling away here. A closer look at those results. First of all, the national popular vote, which has taken, continues to change slightly as there are being some, have been over the last few weeks, some mail-in ballots counted in several states. Over 81 million votes for President-elect Biden, which is a record high number of votes. President Trump with over 74 million votes, which ironically is also a record high number of votes. The previous record was set by President Obama in the 2008 election with 69 million votes. So both the 2012 and 2016 elections, saw the winning candidate with less than 69 million votes. So it was kind of a record increase in turnout on both sides there. Ultimately, the split in the popular vote nationally coming in right now at 4.5%, with Biden with 51.4 and Trump with 46.9. Notably, though, in the Electoral College, a much tighter race. So just consider the states of Arizona, Georgia, and Wisconsin, again, which were three that Trump won in 2016 and Biden won in 2020. You see here the approximate margin of victory. I just rounded out to an even vote count, but the percentages are accurate. 10,000 votes, just over 10,000 votes in Arizona was Biden's margin of victory. It's just 0.3%. In Georgia, just over 12,000 votes, which is 0.2%. And Wisconsin, 20,000 votes, which is 0.7%. So, collectively, if you look at those states, that's 42,000 votes. In a world where, 22,000 of those votes, just over half of them had flipped, you would be looking at 37 electoral votes flipping from Biden and Trump. And if you just go back to our last slide here, 232 plus 37 equals 269, and 306 minus 37 equals 269. So if you just had over 20,000 people nationally flip their votes, even though the national popular vote would look as it was, you would be 269, 269, the race tied in the Electoral College and thrown in the House of Representatives. So this is all to say that it was a very, very close race. On the right side, you see the timeline for the Electoral College, as I mentioned, on my last slide here. The key is that yesterday, December 8th, was actually the deadline for all the states to resolve any disputes they had in the election. So any recounts, court contests, anything else in the states from the campaigns and the candidates had to be resolved. And as of yesterday, all of the 50 states have certified their election results. So the rest of the timeline for the next month or so here at the Electoral College December 14th in each of the states, they meet and they officially cast their ballots. By the 23rd, that's the deadline for the federal Congress to receive, or the Senate, to receive the results of those elections. And then looking into next year, January 6th is the official counting of those electoral ballots and the declaration of the president. And then January 20th is Inauguration Day. So again, President Trump is still, looking at the legal process to, challenge the results of this election. But based, as we see here, on the timeline for the Electoral College, absent the Supreme Court stepping in, which they've just in the last 24 hours said that they're not going to do as it relates to a lawsuit in Pennsylvania, but there are appeals, and you never know quite what's going to happen with that process. We're moving ahead and planning for a Biden administration to take office on January 20th. So what does that mean for the healthcare world? This is the key planks of the Biden-Harris campaign in terms of healthcare policy, the key things that they campaigned on and that they want to do. And this is kind of pushing COVID aside for just a minute, broader healthcare policy issues outside of the pandemic. The public healthcare insurance option, which is adding an option onto the ACA, Affordable Care Act, or Obamacare individual insurance exchanges, that was a major plank of the plan. Also increasing the value of the ACA tax credits, the premium tax credits. So kind of shoring up and adding to the Affordable Care Act, which of course, remember, was a major initiative of, then Vice President Biden to President Obama, his 8 years as Vice President. So kind of a legacy issue for him and something he wants to expand on in his presidency as well. Also talked about adding what, right around the Obamacare margins again, a premium-free public option for Medicaid expansion eligible population in states that have not expanded Medicaid. So in the dozen or so states that have chosen not to expand Medicaid, the gap for those individuals based on their income who would be, the expansion eligible individuals, they want to add basically a free of cost public option that would have the same characteristics as a Medicaid program, the same benefits as Medicaid for those beneficiaries. So kind of a workaround to basically, from a federal perspective, expand Medicaid in those states that did not. Also looking to reduce the eligibility age of Medicare and allow a buy-in for individuals at age 60. So from 60 to 64, have the ability to buy into the Medicare program as opposed to waiting until 65, which is currently the eligibility age. Also looking to double the investment in community health centers from a federal grant perspective. And then several other proposals around the transition to value-based care. Surprise billing is something they've spent a lot of time on this year in Congress and something he supported, more of a bipartisan issue. But really looking at the totality of these policies here, there are some things that can be done through the regulatory process, but pretty much all of these coverage expansion options would require an act of Congress or legislation. They're not things that the president or the administration or CMS or HHS acting under the president can do on their own. So this really highlights the importance of the congressional elections, which I'll talk about on the next few slides, and why the president and the results of the presidential election here are certainly very important in the healthcare world, but equally important, again, as you see this agenda, if it actually is going to be enacted, it will require a partnership with Congress and legislation to actually pass. This is one of the areas that is currently still up in the air. So the U.S. Senate, the control of the Senate between the two political parties still hangs in the balance and is ultimately going to be dependent on the results of two runoff elections in the state of Georgia on January the 5th. So the current Senate, the 116th Senate that is seated right now, the balance of power is 53 Republicans to 47 Democrats, which two independents caucus with the Democratic Party to enable that 47, just kind of technically speaking. As a result of the elections, and you had a third of the Senate, 33 odd senators up, which is the case every year, we have 50 Republicans and 48 Democrats with those two runoffs hanging in the air. So depending on what happens with those runoffs, you're going to have as many as 52 Republican senators as few as 50 and as many as 50 Democratic senators and as few as 48. So it really comes all down to Georgia, and with a 50-50 tie, if the Democrats were to sweep those two races in Georgia, the vice president as the president of the Senate would be the decisive tie-breaking vote. And in this case, it'll be Vice President-elect current Senator Kamala Harris would be the sort of 51st vote that would break ties and, set the agenda. That being said, this was a very different, result than the expectations going into the election. Based on the Senate map and what many were predicting in polling and analysis at the national level, it was projected that the Democrats would gain control of the Senate with several more votes, several more seats. So, again, going back to that last slide and what is the agenda and what in terms of healthcare policy can be achieved, it ultimately heavily depends on what happens in these elections. But even with 50-50 with the 51st vote coming from the president, from the vice president, that's a very thin margin to pursue major healthcare legislation. And then I just pulled two quotes which I think are helpful to understand exactly what's at stake here at the bottom. That were quotes from key senators after the elections, after Election Day. The Senate Minority Leader Schumer, who would become the majority leader for the Democrats were they to win those races, has been very explicit and said, now we take Georgia, then we take America, then we change America. Excuse me. They've really put a lot into this election, and similarly on the other side of the coin, the Republicans. The president was just down there for a rally this weekend, and we'll kind of see what happens there. But it really can't be overstated how important in terms of the DC balance of power these elections are. And also consider for incoming President-elect Biden and his cabinet positions and the appointees that have to be confirmed by the Senate. Those are many of the type of issues that come down to a party line vote, and there's a huge difference between 51 to 50 versus 50 to 40, 48 in terms of making those things happen. So also notable that most legislation, major legislation, requires 60 votes, a 60 vote threshold, so more than 51 votes to clear the legislative filibuster, which is a policy in which it's sort of a Senate rule that allows any one senator, if there aren't 60 votes in support of it, to not advance a bill to the floor to be voted on. And one of the Democratic senators has made it clear and said that he's not going to be voting, Senator Joe Manchin from West Virginia, who's one of the more moderate or conservative members of the Democratic caucus, to end that filibuster. So that has kind of changed the calculus as well, because on major healthcare policy issues, they're not willing to change the Senate rules, which was something that had been discussed prior to the election. But I think, in terms of a major healthcare policy issue that unites the entire Democratic Party, there certainly are things that they could do with 51 votes, with a 50 to 50, split, and ultimately we'll see what happens. And just for those who are scratching their head and are wondering why are there two Senate races in Georgia on January 5th, Georgia's process for Election Day, November 5th, is that they have multiple candidates in the race for Senate. If no one candidate reaches 50% an actual majority of the votes, the top two candidates go to a runoff. So it's just a one-on-one race on January 5th. And that happened in both races in Georgia. So that's kind of how we ended up where we are. So stay tuned for another few weeks as to what's going to happen in the Senate and obviously the whole political world, including especially the incoming Biden administration. Will be watching this extremely closely. Flipping over to the lower chamber, the House. These were, some unexpected results. So nationally speaking, going into the elections, that right now the Democrats control the House with a 232 to 197 majority, and they were expected to pick up 10 to 15 potentially seats, depending on what projection, which polls you were looking at, to increase their majority. And even though there are two races that have yet to be called today, as a result of the elections, we're looking at next year 222 Democrats and 111 Republicans. So while they were projecting double-digit gains for the Democrats, the reality was double-digit gains for the Republicans. So really a surprise nationally, going against a lot of the predictions in the polling. And I include a couple news quotes at the bottom there from some of the national organizations, Politico and ABC News, in the days following the election, calling it a dumpster fire, saying it was a failure to, sort of help you understand exactly what a split decision this was in terms of looking at the totality of the president, the House, and the Senate races between the two parties. Nationally speaking, the Democrats are obviously very happy to have won the presidential race, but are very unhappy and disappointed with the results in the House and the Senate. And, why I think this is important in the healthcare policy, with the healthcare policy hat on and thinking about what might happen, is that the game of expectations is very important. And, revisiting what was projected before, the races over a month ago, the average of polls from Real Clear Politics nationally in the presidential race going in had Biden up over 7%. As I showed you, won by 4.5%. So underperformed those polls nationally. And that did trickle down to both the House and the Senate races. 538, the popular political polling and prediction site, they put out their projections based on all their statistical models of what they were projecting for the House and the Senate, and their average of what they thought would happen in the House was 239 seats for the Democrats, and in the Senate, 51.5 seats for the Democrats. And as we saw now, they're sort of outside of those even medium projections, on all counts now. And going into the elections, they had a 72% chance, predicted to have a 72% chance of controlling the presidency, the House, and the Senate as a result of the elections. Again, the Senate still hanging in the balance, so technically that still could come true, but certainly, not the decisive up and down the ballot, wave victory that they were looking for. And, to further highlight, and I always think it's instructive and helpful to have a comparison for political purposes as to, what does this compare to and what might be looking at in 2021, to compare to recent memory. Look at the 2008 race and the 2020 race and the margins here. So in 2008, President Obama won the presidential election by 7.2%. And he came into office in 2009 with 256 Democrats in control of the House and 60, it was 59 and later became 60, Democrats in the Senate. So very large margins in what they call, political coattails. So up and down ballot support, and kind of swept into office having campaigned on healthcare reform, and with this, party support in Congress to ultimately achieve and ultimately pass what became Obamacare and the Affordable Care Act. On the flip side, for 2020 elections, the result of the 2020 elections into 2021 with President-elect Biden, his margin was smaller at 4.5%. And then, in the House, looking at about 222 seats to 213 seats, which is in fact going to be, regardless of what happens in those two outstanding races, the smallest margin of the majority of either political party in over 20 years in Congress. So Speaker Pelosi next year will have the smallest working majority, where she can really only lose a handful of members on each vote to maintain, that vote going forward on a party line basis. And in the Senate, on a best case scenario, 50-50 or 51-50 from the Democratic perspective. So this all means that it's going to be very hard to push through any partisan or, lacking in Republican support legislation next year. So a lot will hang on, regulatory and executive action, which there will be a great deal of, and there'll certainly be some changes. But I do think it's important to underscore that, the results of the election were very much a split decision nationally between the parties. And as you look at two very different blueprints nationally of what the Republicans and Democrats want to do in terms of healthcare policy, we're still kind of straddling both of those worlds. And I don't see a wave of change kind of pushing things radically in one direction as a result of this election. And that's largely what we've dealt with the last several years, with a split split control of the presidency and the House between the two political parties, where they had to sort of, look for compromise or bipartisan issues. So that is, my detailed rundown of the elections, again, with an eye towards what happens in the healthcare policy world. Next, I'm going to turn to what are the healthcare policy impacts, and I'm going to talk about where we are right now, because so much is happening and there's a lot of work left to do, both on the regulatory and the legislative front in the last several weeks of 2020, or the lame duck session as they call it. And then talking a little bit about the 2021 agenda for President-elect Biden and what that might look like. And just this week, we've had more news around him filling out the appointees and nominations for his healthcare policy team. And I'll talk a little bit about who those individuals are and what that might mean for the healthcare world next year and beyond next year. So the first item, the lame duck congressional agenda. So there are two big items on Congress's must-to-do list. I won't call it the to-do list, things they must do before they can go home for the holidays, which they are all, as they are every year, trying desperately to do. Government funding right now, midnight, Friday night into Saturday morning, government funding is set to expire, leading to, if it were to expire and they weren't to pass a legislative extension or fix, it would lead to another partial government shutdown. And that's something they've been working on for months to try to extend. Originally, it had expired at the end of the federal fiscal year, which is September 30th. They sort of punted several times. Right now, this week, they're trying to buy themselves another week of time. And the House and Senate are set to vote this week to extend funding another week to December 18th. So they're going to kind of continue to kick that can down the road. But what they're looking at is a multi-trillion-dollar spending or budget package that will carry the federal government and fund the federal government through September 30th of next year. The federal fiscal year ends again September 30th, October 1st of each year. So that's the one agenda item, and there are obviously a lot of healthcare provisions and healthcare funding included in that. Many of the safety net programs for community health centers, Medicare, Medicaid, extenders kind of wrapped up in that. I expect it to be extended at current levels. It's just a matter of how that happens. And the complicating factor in here is the number two item, the COVID aid. So, COVID aid is something that's occupied pretty much all of the efforts of Congress this entire year. Going back to earlier this spring, they passed a series of bills, 3.5 is 4 bills, 3.5 phases, because phase 3.5 is sort of an extension of phase 3. And they've struggled since April to pass another bill. And they've been working for weeks and months on passing a bill. Things changed after the election because it was now, known that President Trump would not be the president next year, and it sort of gave a different calculus between the political parties on negotiating out the aid or stimulus package. This is something that is evolving by the hour and by the day. Offers and counter offers. I was just reading before I came onto this webinar that the Democrats had rejected the most recent proposal from the Republicans, and the Republican Senate Majority Leader Mitch McConnell came out and blasted the Democrats for doing so. So stocks were kind of dropping based on the seemingly that right to now today it looks less likely than yesterday that they're going to come together on some deal. It remains to be seen. But this is important in the healthcare world because there are going to be some healthcare provisions, including potentially some provider relief funding, COVID funding, and then small business loans for those who are or have taken advantage of the various different CARES Act programs, including the Paycheck Protection Program for small businesses, which I know includes many physician groups. There are those provisions, in the bill, and that would be a major part of the bill. So, we'll see what happens on that in the next 2 weeks. Again, government funding and COVID aid are the two things that they're dealing with in the lame duck, and there really is a ton of pressure on both political parties, to deliver something before they can go home for the holidays. Notably, though, whatever they end up doing in the next couple weeks will kick the can a few months down the road. Even the most recent bill on COVID would just extend certain programs until the end of March through the first quarter of next year. So what we're in all likelihood looking at is some bill passing probably in the next month, as well as teeing up, must-pass legislation with expiration dates in the early days of the Biden administration with the new Congress next year. So stay tuned for action both in the next couple of weeks as well as in early 2021 around several of these programs as well as government funding overall. Pulling back just a second before I dive into the Biden administration transition stuff, because I think in addition to what's happening in Congress, it's important to understand where things are from a regulatory perspective in the final days of the Trump administration, because this will lead into the Biden administration and also help you visualize, what is and is not going to change based on the regulatory, compliance issues you've had to deal with the last few years, as well as the programs that, we've all kind of gotten used to and have spent a lot of time preparing for. So the Trump administration's, I'd say, post-Obamacare repeal effort healthcare policy agenda, which is a very bipartisan agenda, at least in terms of the goals, was outlined by Secretary Azar of HHS in 2008. And the four priorities are opioids, prescription drug prices, individual insurance markets, and value-based care. The most important for healthcare providers and physician groups happens to be value-based care. And the plan for value-based care, or value-based transformation, as they called it, focused on these four priorities that they outlined several years ago. Data interoperability, price transparency, value-based payments, and reducing burdens. And largely the key regulations we've dealt with and that have been finalized or are currently being finalized as we speak or in the last month or so deal with many of these programs. The interoperability and information blocking rules, the 21st Century Cures Act rules, which were finalized this year and set for implementation over the next several years. The price transparency initiatives, which are initially set to hit insurers and hospitals, finalized over the last year. The value-based payment initiatives, the changes around ACO payments, the primary cares model, the specialty models, a lot of work done over those the last few years. And even just last week, the primary care's geographic model, for sort of the most advanced risk-based model for primary care, announced officially, and we'll have an application period in early 2021. So, and that again announced under the Trump administration will be something that will have to be implemented by the Biden administration. Then the burden reduction initiatives, the E&M coding system overhaul set for January 1st of next year, MIPS value pathways, which was delayed until 2022, but something, kind of launched by the administration as a way to reduce the burden of current programs. So all of these taken together are some of the regulations as well as the agenda. And I'll also throw in the pandemic, because obviously so much of what we've been focused on this year and, kind of had to put first and foremost has been the pandemic. And from a federal regulatory perspective, I talked a lot about this in my previous webinar in October. But the pandemic response focused on the National Emergency Declaration from HHS and the regulatory waivers, the telehealth waivers and payment policies effective during the emergency, all the different aid programs, and again, depending on what happens in Congress, could see some changes here or further addition of funds or creation of new programs. But this is really in one slide, I think, as you think about the Trump administration exiting the stage from a healthcare policy perspective, for healthcare providers, I think this will be much of, the work they've done and things to consider, do these programs stay or do these regulations go away? So this is kind of what they're finishing with and leaving off and kind of handing the baton off to the Biden administration. And again, remember back to the slide, 2 slides ago, the priorities there, value-based transformation and transition to value-based care, is a bipartisan priority that was largely launched and given a shot in the arm under the Obama administration and Obamacare. And it was something that is a legacy issue for President Obama and will continue to be a legacy issue for his previous vice president, soon to be President Biden. In terms of specific regulations, and I won't spend much time talking about this, just want to make sure everyone's aware that they have been released. Last week was the regulation week from CMS. It usually comes in November of every year. They delayed it until December of this year due to the pandemic, which obviously doesn't leave us much time to digest these rules and figure out what we have to do before January 1 of next year. But here you see the press release from CMS and the physician fee schedule rule, 2,165 pages. Still analyzing some parts of that rule myself. Released December 1st. Again, effective January 1. Just to call out a couple key areas of reforms here, the physician fee schedule rule released every year for Medicare deals with quality programs, payment rates, and other payment policies. But this year, telehealth services, the E&M office visit reforms, which again have been multiple years in the making, and they're set for January 1 of next year. The corresponding cut to the overall payment rates and the conversion factor, which has been quite controversial and will impact certain specialties, certainly more significantly than others. MIPS reforms and our ACO reforms all included in this 2,000-plus page rule. So again, just released last week, and this being a post-election item in the final days of the administration. Meanwhile, the outpatient hospital and ambulatory surgical center rule, the OPPS and ASC rule as it comes, this was over 1,300 pages, again, effective January 1 of next year, and policies for outpatient hospital procedures and services, as well as services and surgeries delivered in ASCs. This rule continues the migration to lower cost centers and sort of site neutral policies, paying the same for a procedure if it was done inpatient or outpatient. They're eliminating over the course of the next several years the inpatient only list of procedures and adding additional procedures to the ASC covered procedures list, including total hips, to allow those procedures at the discretion of the physician to be performed in the outpatient or ASC setting. So, and you see the quote here from the current administrator of CMS, Seema Verma, allowing doctors and patients to make the decisions about the appropriate site of care. And obviously during COVID, this has been highlighted as a real benefit for those looking to get surgeries done, whereas the hospitals are full and they've, not allowing in many states still or have serious restrictions around elective surgeries in hospitals, ASCs, and on the outpatient basis, but especially in ASCs, surgeries right now are allowed to continue. So this has kind of been a long-term trend that in some ways, like telehealth, has been even given an additional shot in the arm under the COVID emergency. But, again, a policy that has been, a long time coming, but, here we see it being finalized in the last month of the Trump administration. So that's, both from a legislative and a regulatory perspective. I don't expect a lot more in terms of healthcare regulations. Those Medicare ones are the main ones that come out each year. That's kind of the agenda as I see, depending on what happens with COVID being a big question mark. And we'll definitely see some different regulations. Obviously, all the discussion around the vaccine, the distribution plan, everything happening there. But that will be the regulations and legislation and sort of the outlook from a healthcare policy perspective that will greet the incoming Biden administration come January. Who that administration will be in terms of healthcare nominees and appointees has actually just been filled out this week. So this is a slide that I have taken directly from the Biden-Harris transition page, and they announced this week, just yesterday in Wilmington, Delaware, President-elect Biden had a press conference and announced his key appointees on the healthcare side of things. And see some names here that may be familiar, others that are likely not familiar. I'll critically note that the Secretary of HHS, which sits atop HHS, that position and CMS are the two I consider to be the two most impactful and important. The CMS administrator, which has yet to be determined or appointed, which I have a question mark for. Because they have the biggest control over the portfolio of healthcare regulations and the ability to shape those regs. At the same time, right now during the pandemic, there are going to be other roles that are very important, including the Surgeon General, head of CDC, and Dr. Anthony Fauci, the head of the infectious disease group at the National Institutes of Health, has been already named a chief medical advisor and kind of a leader of the COVID response. So having some continuity from the current administration into the next. But I think there are, whatever happens with the CMS administrator will be key to see. The HHS appointee and nominee Javier Becerra, the current Attorney General of the state of California, was previously a congressman for over 2 decades from California, a lawyer by training, obviously, as an Attorney General. That's the perspective he comes at in that HHS role. He's very vocally been a opponent of some of the Trump administration's regulations and efforts to, overturn or reverse certain elements of the Affordable Care Act, Obamacare, and brought legal challenges against those. And I think that was one of the things that raised his profile in the healthcare space and probably led to this appointment here. But notable that he's, in that position at top of HHS. It's in some ways different administrations will appoint many times a physician, someone with a clinical background, in other ways someone with a legal background. As it stands in the Trump administration, the first head of HHS was a doctor, Dr. Tom Price, who came from Congress. The second and current, Alex Azar, was an attorney by training and previously a general counsel at HHS, and then went to work in the pharmaceutical sector before coming back as HHS head. But they had different approaches for that reason. I mean, Tom Price, as a physician, was sort of a figurehead and a very vocal, out in front on the PR side of things. Took that perspective to that role. Meanwhile, Azar, from the more legal and policy basis, previously having been the general counsel number 2 at HHS, was there more to get things done on the behind the scenes regulatory front. So I think we can glean from Becerra's role and his activity over the last few years in these Obamacare lawsuits that he will be taking more of that role of pushing regulatory changes, kind of challenging things, as opposed to being more of a physician figurehead who's kind of out in front from a messaging perspective and sort of delegates that role to others. Senate confirmation needs to happen for several of these roles, including HHS and CMS. So again, those Georgia elections could be key. More to come, but the team is definitely starting to take shape, and a big focus is obviously going to be on COVID. And if you look at the current healthcare priorities, and as outlined on the transition website here, and this is word for word, there's 7 priorities around COVID that they've put together in combination and in consultation with the group I just showed you on the last page. This is their 7-point plan to beat COVID-19, as you see here. A focus on testing, PPE, guidance around reopenings, vaccine distribution, something we've heard a lot about this week, obviously with the pending emergency approval of the Pfizer vaccine expected for tomorrow. Looking more ahead, the point number 6, rebuilding and expanding defenses for the next pandemic, and then the mask mandates, which we've also heard from this week. But I think you look at these policies in totality, and on the transition website, not necessarily a lot of meat behind the bones. That is to be expected, as the transition is largely and the website certainly is a political operation. But do note that these appointees I mentioned on the last slide are busy and are currently working on the transition to create the policies and the regulations that will implement some of these changes. And certainly we'll see some of these things happen on day 1, January 20th of next year. We've already heard President-elect Biden start to talk about the first 100 days. Obviously always symbolic and something that a president wants to put his mark around. But I think COVID is the first, second, and third priorities, and obviously the economy being a closely wrapped into the COVID situation and shutdowns, reopenings, et cetera. But COVID being the top agenda item and kind of overshadowing all other healthcare policy issues, at least from the start. But that being said, there are other healthcare policy priorities, and I showed you when talking about the election, the campaign policy platform, the different things they want to do. But the 4 identified in terms of categorical Biden healthcare policy priorities, along with here with a quote from the transition website again. COVID, obviously, number 1. Protecting and defending and expanding the Affordable Care Act, number 2. Expanding access to insurance, and again, throw into that bucket, lowering the Medicare eligibility to 60, expanding Medicaid eligibility in those states that didn't, the public insurance option, expanding premium tax credits, everything there. under the expanding access to insurance bucket. And then the fourth, reducing, disparities, both in terms of racial disparities as well as those income-based disparities, which is something that the incoming administration wants to, put a premium on, and something that was a very, a big campaign issue on their front. So you see the quotes there around pre-existing conditions, lower healthcare costs, and expanding quality. Obviously, that sounds, quite familiar. We'll see ultimately how many of these policies come together, and ultimately what happens legislatively. Again, Georgia will be key to that, as well as what happens through regulations and regulatory changes. I'll just say, healthcare is different than, obviously, we all live and work in healthcare, but just note that healthcare is very different than other areas and other industries. And one of the reasons is that there are these annual rulemakings and sort of must regulate, must legislate, must do something events, both in Congress, where they have healthcare programs they have to reauthorize every year, as well as the annual Medicare regulations and other things, where the incoming administration will automatically have an opportunity where they'll be forced to. It's an opportunity to do something, but it's also a requirement to do something. So in other areas, they can kind of take a few years or a few months to fill out the team and to figure out exactly what they want to do. Healthcare, and it's different during the pandemic, but in every administration, is something that forces action early and often with these annual rulemaking opportunities. So expect, while there are some questions as to exactly what will happen in the Biden administration, these things to surface quite quickly, because they really have to start writing those annual regulations that come out and proposed rule in the summer, immediately in the spring. And also consider that many of the people who are being staffed in the incoming Biden administration are people who worked for then Vice President Biden under the Obama-Biden administration, and are kind of coming back for round two. And you have a lot of the same career employees or civil servants at CMS, at HHS, who they know and will be kind of well versed in how to quickly get those policies and those trains back running. So I expect a lot of regulatory activity next year. And to revisit for just a second here, the outgoing Trump administration healthcare policy agenda, around data interoperability, price transparency, value-based payments, burden reductions, and the pandemic. What is going to happen with that with the Biden administration? Are they going to get rid of all of it? Or are they going to keep much of it? I think in terms of policy, goals, the left-hand side of the screen here, these are all goals that are bipartisan, that are shared by, both the Trump administration, and largely were shared by the Obama administration, the Trump administration, and the Biden administration. So they will continue on directionally. There will absolutely be changes around the edges to, timelines for certain rules, requirements under certain rules, specific policies around some of what you see on the right. That's inevitable, and also comes from a larger sort of philosophical difference between the parties in some respects, about the pace and speed of regulations and the role of the federal government in some of these programs. So, consider the pandemic. Obviously, there are going to be some changes, but in terms of a direction of where things are going, the focus on distribution of the vaccine, around wearing masks, around PPE testing, et cetera, directionally the same. They'll make some changes next year around exactly how that happens. I think are certainly inevitable, and definitely different rhetoric around what those programs are, but directionally the changes remain. Similarly, when you look at value-based payments here, Pathways to Success was the rebranding of the Trump administration, by the Trump administration, of the Medicare ACO program. The Medicare ACO program was started by the Affordable Care Act, Obamacare. So that's obviously a program that's going to continue under the Obama administration. They'll probably put their own imprint on it. CMS likes to change the name of programs, kind of make it seem fresh every few years, develop a new acronym, which I still am amazed by where they come up with all these different acronyms. But these programs will continue to move forward, and certainly the transition to value-based reimbursement, as well as a lot of the things that have happened in the pandemic, I definitely expect to be, bipartisan priorities that will continue. But just to quickly run down the list here. Interoperability and information blocking. Those rules came from the 21st Century Cures Act, which was actually signed into law in 2016 by President Obama and is a very bipartisan initiative. Price transparency, some disagreement over maybe exactly what happens with those rules, but from a political philosophy perspective, both parties aligned in the need for more price transparency. Just talked about value-based payments. That's a bipartisan initiative and one of the biggest in healthcare that both parties agree on. Burden reductions in the fee-for-service system. The E&M system overhaul set for January 1 of next year is already kind of pre-baked, and finally baked, I should say, and ready to go on January 1 of next year. And then the MVPs program, I could see going away. Well, it's currently scheduled for 2022, but they really haven't filled in the details of that, so TBD there. And then again, the pandemic, it's a bipartisan issue, a lot of disagreement around certain programs, the size and scope of those programs. But many of the things that have happened in the pandemic, including the CARES Act and the previous laws, highly bipartisan. So that'll continue on as well. So definitely some changes in the Biden administration, but I think things moving forward as well. So final slide here before I pause for any questions you might have. Key takeaways, if you weren't paying attention, this is always the one slide to just kind of perk up for 30 seconds to get your key takeaways and what you need to know from the almost hour I just spent here. The Georgia runoffs will be extremely important to what happens, not only for healthcare policy, but for the entire policy agenda of the Biden administration next year, because they're going to determine ultimately who controls the Senate, the Republicans or the Democrats. And the Biden agenda will vary greatly based on whether they have that 51 to 50 majority with the vice president's vote, or they are in the minority. More COVID aid coming potentially in the lame duck in the next few weeks or in early 2021. This will definitely be in the news over the next couple weeks. I think it's likely that we see some level of something happen this year as well as in early 2021. The next anticipated phase of the COVID response, the vaccine rollout, the distribution and approval of vaccines and the rollout of vaccines is definitely going to dominate the healthcare policy space over the next few months. Also, we're looking at different state level responses and local responses over the next month and a half before the Biden administration takes over that could result in some significant changes, with it seeming like a increasingly bad situation in certain states with hospitals being overrun with COVID capacity. Next year, no matter what happens in Congress, expect a heavy focus on regulatory action. And again, those presidential appointments and ultimately the confirmation or non-confirmation of those appointments will be key. And I look for a focus on not only reinstituting or sort of overturning things that the Trump administration did to overturn what the Obama administration did, but then expanding where possible those Obama-era healthcare policies. So in terms of healthcare, I really do look at it as a winding back the clock 4 years and a continuation of what the Obama-Biden teams had previously been doing. They're going to have to make some changes, or they're going to try to make some changes to what the Trump administration did in certain areas, especially around Obamacare. But then they're going to look to expand them both regulatory and legislatively where possible. One big question mark I have is, with the economy and depending what happens with the economy and some state budget, concerns with potentially declining tax revenues and increased costs for various different reasons in response to the pandemic. Is that going to create some big state government healthcare policy issues, especially around Medicaid at the state level? And what implication will that have for the healthcare provider community? I think that would be key. And then the bipartisan health priorities, all the things I've talked about, value-based payments, interoperability, telehealth, all these different issues that I covered in the webinar pre-election, they're going to continue. There'll be some changes. Obviously, there are always tweaks depending on who's in power, but that transition to value-based care, which was what we were talking about 4 years ago before the Trump administration, in the end of the Obama administration, has made it through the Trump administration and is remaining as a key priority, and probably the key priority for the provider community as we look to the next several years, and especially even more so with the economy and, look at employers' budgets who are paying for healthcare out of their benefit programs, as well as state governments and the federal government looking to get more dollars or more value out of their dollars spent on healthcare through the federal program. So definitely expect those trends to continue. So another way of saying is, as much as things change and we have new people in power in Washington in 2021, many of the things that we've been focused on from a compliance and regulatory standpoint will continue and will continue to sort of move forward into next year. So with that, I have reached the end of my prepared presentation here. I thank you all very much for your attention and for joining us here today. I hope it was informative. I know it's always a lot of information, but I think given not only with the election, but with the pandemic, the outsized role that legislation and regulation are playing in the healthcare sector today, hopefully you glean some insights for it that you can take back to your practice and sort of put on your strategic roadmap for 2021 and have some, confidence, or on the flip side, ask some new questions about, what might be happening and what might be changing as a result of the election. So with that, again, thank you. And I'm happy to answer any questions if there are any.
Sure. So it looks like we did have a couple of questions here. I'm also going to go in the process of opening up everyone's line. So if you have some background noise, if you want to go ahead and mute yourself while I open up the lines here. Let me see. All right. And I do see, let's see here. Oh, there was a question on if this was recorded and when it would be available. So yes, absolutely, this has been recorded, and a link will be sent out following this session. I believe it's tomorrow or the next day. We have it scheduled to send out electronically, and then I'll also follow up with the participants just to make sure that they get the link as well. A couple questions. Assuming Georgia goes blue and the Senate is 50-50, how likely is the 60-plus enrollment to Medicare?
Oh, to change. I think that would be a very difficult thing to change with a 51-50 vote. There are certain policy and healthcare policy agenda items that I think would unite 51 votes on the Democratic side, but I think that would be a very tough one, especially just considering that Medicare and Social Security and Medicaid are really the chief, federal benefit and safety net programs. I think it would be highly controversial for a party to try to, fundamentally change the balance of those programs that have been around for, over 50 years at this point, with a 51 vote majority. So that would be my, I'd say, low likelihood at this point. But again, TBD.
Great. Also, let's see here. What is your take on the trends in fee schedules from Medicare with their recent 10% reduction in reimbursement for 2021?
Yeah, so as a result of the E&M office, outpatient office, payment increases, the overhaul there, and the projected increases, which are going to deliver, potentially a double-digit increase for many primary care providers in the Medicare program. The Medicare fee schedule has to be budget neutral, so that triggers a 10% cut in the overall conversion factor. So providers who do not primarily bill the E&M office visits, surgical providers and other certain specialties are going to see that cut. There are efforts by those specialty societies of certain surgeons, radiologists, et cetera, who do not bill those E&M codes and would be, on the losing end of that 10% cut to overturn that. They've been lobbying members of Congress. I have not seen those efforts, turning out to be successful at this point, but I do think that's something they could revisit, early next year or through next year's fee schedule. But the long plan, it's been several years now in the making, and was in partnership and ultimately adopted the American Medical Association, CPT editorial boards, reforms around the documentation and payment system. Those are, finalized and set to move forward January 1 of next year, and I wouldn't expect any last-minute changes on that. And they were just finalized in the reg last week.
All right, great. So I do have the lines open, so if there are any questions, feel free to ask away. I know we're at the 2 o'clock mark Eastern, so at the top of the hour. All right, well, if there are no further questions, if you do end up having questions in the meantime, please feel free to reach out to either myself or Chris's contact information is up here as well. In conclusion, just want to thank you all for your participation in today's educational session. Hope you found some good information and insights in what we've covered and that you think that the information is going to be beneficial to you and your organization. Like I said, feel free to reach out to any of us for further discussion. But before we go, we want to make sure that you complete the short survey at the end of the session. We always appreciate the feedback. We want us to continue to improve and make sure that we're getting you the information that you're looking for. Again, I mentioned the link for the recording of the session. So also please feel free to forward that on to your colleagues, your friends, your coworkers, whomever you feel this information would be beneficial for. And we also have our next educational session in January, so please make sure that you register for that session as well, out on the same landing page that you were able to register for today. So please feel free to head on over there and register for the next few sessions that we have out there with our speakers and bios and information. And really just thanks again for joining us today. We look forward to seeing you at our next healthcare education series, and have a great rest of your day.